Well, hello again. I'm Colonel Arnold Strong here at the 2019 HEALinc Future Health Summit, and I'm joined by two extraordinary guests here, Dr. Todd McAllister and Cathy Cather of Fountain Therapeutics and Parallel Profile. So the two of you have been here for a couple days. You just flew in actually from London, I think. And both of you are involved inside the primary focus of this conference, which is stem cell and regenerative medicine. So I'd love to know a little bit more about how you think, we'll start with you, Todd, how do you think Fountain Therapeutics has got a tie to this, not only in personal wellness, but really community health?
Well, thanks for the question, Arnold, and thanks for the invitation to be here. Fountain is a stem cell company that's focused on different age-related declines. And the link here really is that we're not only trying to treat patients, but we're trying to look at some of the key aspects of clinical trials design and clinical treatment, and from an ethics perspective and from an ethics or efficacy perspective. So that's what I'll be talking about here.
Right on. How about you, Cathy?
I'm impressed. The reason that I'm here is that what we do is we do precision prescribing, which is taking pharmacogenetics together with understanding how different medicines interact with each other. And until we get to the point where I hope we're going, where very few people need any medication, we want to make sure that the medications they're taking is safe. And right now, one of the things that happens is when someone has a problem, they take a medication. That may cause another problem, which may or may not be identified as related to that medication. So then another medication is prescribed. And it's called the polypharmacy cascade. And the average person in the United States is taking 4, and the average 65-year-old is taking a dozen.
Well, and the two of you both have got to focus on aging and the aging process.
Yes.
And so tell me about that. How is Parallel Profile tied to really easing or improving the aging process?
Well, the thing that's interesting is when people start having problems and they have this cascade, they start taking more and more medications, and we find that through genetic testing, we can take them from a dozen medications to 3.
Wow.
And they get their life back.
Wow.
They don't have as much fatigue, they don't have as much pain, they don't have as much heartburn, they don't have whatever, all those things, and they feel younger again.
And that ties a lot to, similarly with your research there at Fountain Therapeutics.
Well, one of the things that Cathy talked about is the cascade, and I think a related concept is early intervention. Yeah. One of the problems with our healthcare system today is that it's, in my mind, too little too late, right? We come in with symptoms. You talked about your own problems, bone on bone in an orthopedic situation. Had you intervened 3 years or 13 years earlier with treatments, which is what our model is, maybe you never get to that point of being bone on bone, or maybe you never get to the point where you're in a pharmacy cascade using drug after drug after drug. So that's one of the hallmarks of our approach, is that early intervention model.
Wow. So one of the primary themes here with the HEALinc Future Health Summit is not just individual wellness, but really how the second and third order effects of community wellness. So what can you tell me about your vision in either of your vision, in like what you think is sort of the second and third order effects of personal wellness?
I think it's really interesting that people expect to have chronic conditions as they age. They expect to go to the doctor and get a prescription. And because that's become an expectation, also with the expectation of, if it's FDA approved, it must be safe. My doctor wouldn't give me something that would give me another illness. So it's a matter of changing our expectation and saying, how do we change what we're doing to avoid needing a medication in the first place, which may lead to another medication? And here at the conference, we're talking about mindfulness and diet and nutrition and exercise and these other things that have made a radical difference in how some people age versus others.
Yeah.
We add the genetics to it, and it's really kind of a breakthrough. And I've seen so many people change the projection of their aging in my own practice, but also here too, all the different things. And I'm very excited about, hey, maybe a hyperbaric chamber treatment instead of these 3 drugs.
Right.
Those kind of things. Maybe a stem cell treatment instead of these 4 drugs.
Cathy, I'll maybe add 2 points to that. You mentioned mindset, and I think that's one of the critical things that we're trying to shift, which is we want to look at aging as a treatable disease. We want to look at age loss in the same context that we do with weight loss. Why can't we make decisions of lifestyle or of therapeutics?
I wish age loss wasn't as hard.
They're both
weight
hard.
loss.
Let's
They're
face
both
it, they're both hard. But we don't have the mindset. We tend to think of aging as a set in stone eventuality, and we're trying to change that concept. The other thing you talked about community and how this impacts the community. The one thing that we're also massively focused on is democratizing these treatments.
Yes.
For the most part, the treatments that we're talking about here, the luxury is that they're tens of thousands of dollars treatments. So how do we change that into something that's $1,000, $2,000, $3,000? That's central to our mission.
Well, thank you so much for being here, both of you. What a blessing. Thanks you so much for your presence. Again, we're here through Friday at the HEALinc Future Health Summit at Baha Mar in Nassau. Thank you so much for joining us online, and please tell more people about this extraordinary summit led by Dr. Desiree Cox, because we'll be back here again in 2020.